the voice of health, freedom, and liberty, Robert Scott Bell.
From chipping students in Utah to chipping cows? No, chipping your lungs. Lung chips. Supernaut, I heard of lung cookies. You ever heard when somebody's so sick?
Yes, new from Frito-Lay. It's lung chips.
Lung chips. You can't just, what, one? No. Oh, gross.
You can't just breathe one.
My apologies for those who are trying to eat your breakfast or lunch today. But yes, we have to open it with more chip discussion, and it's not the dipping kind of chips. But it looks like mad scientists are in a dash, not only to chip your children to keep them in school so that they can get the money from the feds to the states, but they want to chip your organs. They want to put your organs on a chip. And if this sounds like zombie cannibalism
There's so many food references to this story. It's just you could do one pun after another.
I can't help myself this morning or this afternoon, depending on where you are listening.
On a chip.
Can't help it. So we got heart chips, lung chips, what kind of chips, liver chips. I mean, you got name the organ, they want to do it. But this is serious. This is like wafering your cells into silicon chips and separating them out through vapor locks. I don't know. But they want to do this. And you'd think, well, maybe they want to replace the organs that have worn out, right? Wouldn't that be interesting? Oh, yeah, we've got your organ covered. Just wear it out, burn it out. You don't even need a transplant anymore. Here, have this chip. What, do I eat it? Do you implant it? Well, you already implanted my kid with a chip? Wait, not that kind of chip.
Right out of a science fiction movie.
It is. It's the Gattacization, right? The article we saw. In fact, we're going to talk some wild stuff with Mike Adams this hour. In fact, Mike's going to be coming up shortly. And we're going to talk about the flame virus technology. This guy's got serious background in technology, Mike. It's not only health with him. So we have to cover that. But this is a technological leap, breakthrough, or disaster in the artificialization of all life. Now, you think, is this to save people who have lost an organ, lost a limb? Can we chip these things back together? Well, it turns out there's a much more nefarious idea here, and you can bet somewhere in there the drug companies want in.
It may not look like a lung, but it contains the organ's cells and functionality, positioned tightly together to fit on a single microchip. Shea and his colleagues at Harvard's Wyss Institute are breaking new ground in biomedical engineering, according to their director, Don Ingber. He says that after years of research, the scientists are now able to replicate all types of human body parts.
Lovely.
Wow.
They've been working on this behind the scenes for years, and it's not just the kind of Frankenstein thing. Let's pull a body part from somebody else and sew it onto another, but it literally is now the electronic age, the computer chip age of organs.
It's almost reminiscent of something like the Bionic Man. This is Steve Austin. We can build them faster, stronger, But, even that I would be kind of fascinated with because, listen, if I got my arm or hand cut off or something like that, if they could replace it with something that was functional, sure, it sounds like a good idea. But that's not what this is about. This is, as you were alluding to, something far more nefarious going on here.
Rather than building a whole organ, could we build sort of the minimal functional unit, a 3D cross-section of your lung or your gut or your liver that would have human cells and that would reconstitute or mimic the way a whole organ works? And then eventually, could you link many of these together and have sort of a human body?
Ingber says the technology has the potential to revolutionize the way pharmaceutical companies test new drugs.
Oh!
Ding, 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 ding.
We got a winner. We got a prize. The drug industry wants in. But, even before we got to that drug industry revelation right there, wasn't that wicked and eerie at the same time? Maybe we could string these things together. Hey, maybe we can build an entire human body to be what? A robot drug receptacle?
No, Robert, these stories drive me crazy because on the one hand, I want to be kind of fascinated by science and technology. I've always been interested in that. But I got to tell you, over time, I've become disgusted with it because once again, we're seeing the arrogance of man thinking that he somehow has the ability to construct the intricate design of the human body in order to accomplish some sort of goal to make himself feel better. Like, look what I created. And there's no way. It never works. It always ends up in tragedy.
Yeah, maybe they're just getting tired of killing animals or something. I don't know.
The idea here is that the pharmaceutical industry has been limited by the fact that animal studies just don't work. We lose innumerable animal lives at a huge cost. It takes an incredible amount of time, and then more often than not, they don't predict what happens in human clinical trials. So it's back to ground zero.
Dude, they're admitting the entire basis for the drug model is a failure. Every bit
That's
of
interesting. That's interesting. I mean, it's just one guy's opinion, but imagine if that was true, that animal trials don't work. Well, that's how a lot of things are approved for clinical trials, is because they work on animals.
Pretty much almost all of them start that way. And if it basically is an abject failure and it doesn't indicate anything, what have we been doing except slaughtering animals? And it wasn't with a tear in his eye that announcer says, we're so sorry the animals. It's like the expense. It's too expensive. It takes too much time.
Now, wait a minute. Are you trying to tell me this guy is not the chapter president of PETA in his county?
Not unless he can put a liver chip on that PETA.
Oh, see, another pun. I like it.
Well, here, it continues on.
Where animal trials fail, Ingber says organs on chips will succeed because they're made up of human cells and tissue. The lung on a chip is made up of human lung and capillary cells, which are divided by a porous membrane. These cells are sandwiched between a pair of vacuum channels which mimic how lungs flex when breathing.
He said sandwich. I didn't. Oh, no. Don't be eating those lung chips.
I'm sorry. I'm having some organs on chips. Oh, sorry.
It's like I feel like I'm on the set of My Dinner with Andre.
I'm sorry. I couldn't resist.
Of course not. Crunch, crunch, crunch away. They'll make more. This is amazing. Of course, it wasn't to, as you said, and so I would be fascinated. Hey, could they make, replacement organs in a lab? You lose a limb. Could they do bionics? What was it? I mean, there are some bionics, I think, were heavily tested in Israel, for instance, but this is different. This is about mimicking organs or systems so that they can do what? Promote the agenda of the pharmaceutical industrial complex. We've got to test drugs on the tissues here. Of course, if we kill a silicon chip-based liver, it doesn't matter. But the reality or question I have is, how real is the relationship between the chip liver or the liver chip and your real liver? And, of course, every drug that they produce is toxic, so what's the frickin' deal?
Yeah, and that's, I think is the big question in this, is that how can anybody that understands the complexities that are involved in organs and how the organs relate to the other organs and the interactivity within the human body that are dependent on so many different factors, that if you think you can create a lung on a chip and stick a drug on that and say, oh, look, this is what it does, you have no idea what that drug actually does when it's ingested, goes into the bloodstream, affects other organs and other things that are going on in the body. This, to me, like I said, and I say, how many times have I said this? I'm not a scientist. I'm not a scientist, but I don't think it takes a scientist to understand the flawed logic in the direction that they're going with this.
We're just anti-progress. We want to go back to...
I know. We're just, so anti-technology. We want to go ride horses and live in caves, right?
Well, let's see if this story gets any worse before we bring up Mike Adams.
Ingber says his teams are now working on linking different organ microchips together with the hopes of simulating the complex structure of the human body. He says there's still a long way to go, but he hopes one day his organ microchips will replace animal studies altogether, while at the same time providing a new and more effective way to test new drugs.
Which chip would you like, sir? Well, I don't know. There's just so much to... Hey, just throw them all on. Can I have a pizza with everything? Throw every organ on. Oh, my gosh.
Oh, it's insane. It's absolutely insane.
Yes, we got to have more ways to test those drugs because those darn animals, too expensive, we're killing too many, and so we need your organs on a chip.
Yeah. This has nothing to do with animals. I'm sorry. I just refuse to believe this has anything to do with animals. This is about trying to create a way that is cheaper, more efficient, and to put drug approval on a fast track because Lord knows we need more of those.
And look at this, Super Don. If they use the drug on the lung chip and the lung chip doesn't die, like it's alive, oh, it didn't die, so it's got to be good. We'll put it into people now, right?
Yes, and I can't wait to see an entire human body made up of chips, the lung chips connected to the heart chip.
Right.
I mean, I cannot wait to see what this looks like.
Incredible.
What is it going to be this big, I don't know.
Listen, I think that technology, Super Don, that technology is going to come to a screeching halt when we learn about the next story with Mike Adams. The Health Ranger is going to join me next to talk about the flame virus. Could it be the end of the technological world as we know it? Oh, no more liver chips and beyond. And then we'll be back, Super Don, in next hour. I've got Ronnie McMullen. We're going to talk about the Life Change Tea and what it can do for you, what it's done for me. So lots more healing to go on the Robert Scott Bell Show. RobertScottBell.com, 866-939-BELL.
The Robert Scott Bell Show.